Hello everyone and welcome back to another Pikeville Medical Center Specialty Spotlight. I'm your host, Carly Lambert, and today I'm joined by PMC nephrologist, Dr. Kanan, and medical assistant, Erin Tackett. So today we're going to be talking a little bit about nephrology, and nephrology is a specialty that we offer at Pikeville Medical Center, but it's not really highly discussed. So let's just start off by talking about what nephrology is, what type of conditions you treat, and what type of patients you see.
Sure. So nephrologists are medical doctors like any other subspecialty. They care for your kidney diseases and support it if dialysis is necessary. Like each of us are born with two kidneys, and they do the utmost function of maintaining balance or homeostasis in the body. And kidney diseases, either primary or secondary due to other medical conditions, can disturb this balance and cause like changes in blood pressure or mineral ratios in the body, things like that. So as a subspecialty, we offer inpatient consultations for patients with acute kidney injury or chronic kidney disease due to other medical conditions or uncontrolled hypertension or other problems associated with kidney diseases. We oversee dialysis, both hemodialysis and peritoneal dialysis, both in the inpatient and outpatient setting. We see patients in the clinic with chronic kidney disease or who are being referred to us by their primary care physicians for acute kidney injury or hypertension, again, or other problems associated with kidney diseases. In addition, we teach medical students and residents, and we perform a lot of clinical research in kidney diseases here.
Awesome, yeah. And so something that you touched on was that hypertension is kind of something that's involved in these kidney diseases. So, and talk about how we can be cognizant about our high blood pressure, how we can prevent that.
Sure. So high blood pressure is a silent killer. At least half of American adults have high blood pressure, and many don't know it. So one way to know if you have high blood pressure is to have your blood pressure checked. So there are a lot of risk factors that can lead to high blood pressure, and high blood pressure and kidney diseases go hand in hand, or they're like the two edges of a sword. There are a lot of tiny networks of blood vessels in the kidneys. They supply the filtering units in the kidneys called nephrons, and when you have high blood pressure, it damages these filtering units so that the kidneys stop filtering your blood efficiently, so you start accumulating waste, and that can lead to chronic kidney disease. And chronic kidney disease, in turn, can cause a negative spiral, which leads to high blood pressure. So they go hand in hand. And all you have to do is follow 5 simple steps to control your blood pressure. But before that, blood pressure cannot be cured, but we can keep it under control. So the things you have to do is know your blood pressure, know what your target is. You have to know what the normal blood pressure is and what your current blood pressure is and what your goal should be. And then you have to work with your primary care physician or your nephrologist to come up with a plan, to set a goal, to come up with a plan about your diet and medications. And once you're on medications, you take all your medications regularly as was prescribed. And then you should take ownership of your high blood pressure management such that you measure your blood pressure at home regularly and monitor it. And the fifth most important thing, probably that will come as the first recommendation, is lifestyle changes. Like, simple steps like eating healthy, like lots of fresh fruits and vegetables, less saturated fat, low sodium diet, like less than 1.5 grams per day, physical activity, maintaining a healthy weight, like, a BMI of between 18 and 24 is a good BMI, body mass index. Quitting smoking, limiting alcohol intake, or some of those things that will help control the blood pressure.
Yeah, so high blood pressure is just one symptom that some of these patients may be experiencing. So talk a little bit about something that may be a symptom of having a kidney disease or a kidney problem that a primary care doctor will notice and refer you to the nephrologist.
So kidney diseases are usually silent. They are referred to as silent killers because many people who are referred to us will have mild symptoms or no symptoms at all.
It's really something noticed in the blood work first.
Yes. So your primary care physician will do blood work periodically, and that's how we detect if your kidney function is low or good. And ideally, you should see a nephrologist when you what we call glomerular filtration rate based on your blood work, it starts to decline. And then the other things that your primary care physician can refer you to a nephrologist can be like blood or protein in the urine or uncontrolled blood pressure, like you're on like 3 or 4 different medications and your blood pressure is still uncontrolled. Or for things like polycystic kidney disease, like if you have autoimmune conditions like lupus or IgA nephropathy, and sometimes you can have inflamed kidneys become big and you could have blood or protein in the urine. Those are some of the scenarios that your primary care physician can refer you to a nephrologist.
So I think one of the most common kidney conditions that we hear of the most is kidney stones.
Right.
So talk about what kidney stones is and kind of the effect that it can have on someone.
Sure. So kidney stones are nothing but mineral or salt-based deposits in the kidney. Kidney stones are really painful, especially when you have to pass the kidney stone through the urinary tract. Forming kidney stones means that the kidneys are not filtering your blood effectively and they start to accumulate the waste and the salt inside your kidneys. So there are 4 major types of kidney stones, calcium stones, and then there is the uric acid stones, there is struvite stones, and something called cystine stones. Cystine stones are very rare. Calcium stones are the most commonly seen in this region. And as for any stone, one of the major risk factors is dehydration. Being in hot climate and with climate change, dehydration is one of the major risk factors for forming kidney stones. The second major thing is diet. For example, oxalate-containing foods like grains, legumes, chocolate, tea have a lot of oxalate. They bind with calcium and they form calcium stones in the kidneys. Some food like red meat or organ meat or shellfish, they have a lot of naturally occurring compound called purine. Purine in the body gets metabolized to uric acid and you can form uric acid stones in the kidneys. Not all patients are prone to form kidney stones, but those who are prone to form kidney stones, dehydration and diet can increase the risk of stone formation. So once we know the risk factors, it's easy to get them under control, like drink at least 2 to 3 liters of water every day, eat a lot of fresh fruits and vegetables, and cut down on oxalate-containing food and a lot of sweetened foods and drinks, and fructose corn syrup increases the risk of stone formation. So cutting down on them, reading the labels when buying food helps.
So I know we talked about getting regular blood work done, but talk about a couple of the other tests and procedures that you may do for a patient who's experiencing kidney problems.
We do a lot of tests and procedures for kidney diseases. They are used to screen for kidney diseases, and once you have kidney disease, we use them to follow up for periodic follow-ups. So we do blood tests, and in the blood test, we look at what's called blood urea nitrogen, creatinine, and glomerular filtration rate. These 3 will tell us how well the kidneys are filtering your blood. And then we do urine tests to see if you have protein or blood in the urine. If you have blood or protein in the urine, it could mean that the kidneys are inflamed or there is a kidney stone or an infection going on. And then if there is a stone, or if you have family history of polycystic kidney disease, or if we want to look at the size and shape of the kidneys, we can order imaging tests like ultrasounds, CT scans, MRIs. And then in some cases where the diagnosis is not conclusive, then we can get a kidney biopsy where we take a tiny piece of the kidneys, look it under the microscope, send it to the kidney pathologist. And then in people who are reaching end-stage kidney disease, depending on the modality of choice, if they want to do hemodialysis, we can get a dialysis catheter in the chest. It's just like a port, and do hemodialysis, or a fistula in the arm. Or if they want to do peritoneal dialysis, we can get a catheter in the abdomen and start peritoneal dialysis.
So a lot of these kidney diseases and conditions can be caught if you're going to your primary care physician frequently and getting these tests done. And I know we talked about high blood pressure and some other symptoms, but let's talk about the warning signs and these risk factors that patients need to be looking out for.
Sure. So kidney diseases, as I said earlier, is a silent killer. about 15% of adults in America have kidney disease, chronic kidney disease, and half of them don't know it because they do not have any symptoms. It does not present with any warning signs or symptoms like other diseases. But there are a lot of risk factors that can predispose you to kidney disease. One of the major risk factors is diabetes. So we recently did a work in the Appalachian region of Kentucky on the prevalence of diabetes between 2016 and 2020, and we found that the prevalence is about 12.8 to 13.7% compared to national average of like 10.5 to 10.9%. So we presented this data to American Diabetes Association. So in this region especially, diabetes is one of the most important risk factors for developing kidney disease. Diabetes in general, long-standing, uncontrolled diabetes can lead to chronic kidney disease. The second important factor is hypertension or high blood pressure. Normal blood pressure is less than 120/80, and anything above 130/80 is high blood pressure. Third important thing is any heart disease or stroke or family history of kidney disease or anybody on dialysis, or those are all risk factors for chronic kidney disease. The fifth important thing is over-the-counter medications, pain medications like non-steroidals like Advil, Motrin, Aleve. When you take them for longer periods of time, it can damage your kidneys. So having said that, we know the risk factors. It's easier to control these risk factors and prevent you from getting chronic kidney disease. In this region, another study we did and submitted to medicine is on the use of recreational drugs. So early adulthood, we have to be really cautious about the use of recreational drugs. In this region, the use of recreational drugs is on the rise, and the kidney diseases associated with them are on the rise as well. So we found that the use of like either synthetic opioids or prescription drugs and cocaine and methamphetamines are on the rise, and their use is associated with high blood pressure, glomerulonephritis or inflammation of the kidneys, and even kidney failure to the point of needing dialysis.
So talk a little bit about what dialysis is, because I know some of our viewers may not know, and it's really important to know, because if your kidney disease goes untreated,
Right.
that's what can occur. So talk about that.
So dialysis is when you reach end-stage kidney disease. There is another category of patients who need dialysis in the acute setting, like in the hospital. They are admitted for heart failure or liver failure, or they are severely dehydrated and or in shock or have undergone surgery, and they stop making urine, or the toxin levels build up in the blood. That's when we do dialysis in the inpatient setting. This is for acute dialysis for patients in the hospital. There is another group of patients who have chronic kidney disease. We follow them longitudinally, and once they reach stage 5 of kidney disease, or once they start showing symptoms of like fluid retention, like a lot of swelling on the legs, hands, face, or if the electrolytes in the blood are changed, like high potassium levels or acid load in the blood is very high, and they are not making as much urine, and there is only so much medications we can give, that's when we offer dialysis. So there are two modalities of dialysis. One is the blood form of dialysis called hemodialysis, where we place a port in the chest or a fistula in the arm for hemodialysis, and patients go to a dialysis unit 3 times a week for their dialysis. The other one is called peritoneal dialysis, where you do dialysis at home. Every day at night when you go to bed, you just hook up the peritoneal dialysis catheter, which we place in the abdomen, and the machine does all the dialysis treatments, and when you get up in the morning, you unhook yourself. So those are the two modalities of dialysis treatments we do in the outpatient setting.
Awesome. So I want to thank you all so much for taking the time out to come and talk to me today. It was really beneficial to me. Hopefully it was beneficial to our viewers as well. So this concludes this episode of the Pikeville Medical Center Specialty Spotlight. Thank you so much for watching, and tune in next time as we spotlight more specialties.